Okay, so another Eaglesoft video. So you're gonna kind of go in, click the icon, open it up, find your name, put your password in, log on. It's gonna log you into wherever you logged off of last time. So I'm usually in the clinical portion, but you might go into the front office. Again, you just find that by clicking over here, clinical. When you log in, if you're going to be taking x-rays or if you're taking an impression or whatever you're doing in that lab, it doesn't matter what sim you have. You can have sim 1, 2, 3, it doesn't matter. You just need to make sure that you pick your own sim. So you're going to go in here, and this is my clinical. You want to always have your patient's information pulled up if you're going to be working on that patient, so you can see what was done in the past or anything like that. So you're going to click patient, and then you're going to find your sim. So it's going to show me, it's sorted by last name and showing active. So if you type in sim and hit tab, well, I guess we should look up the last name. So you're going to type in your first name, and that's going to show up your last name of your sim. Sorry. So this sim, his first name is Sim, his last name is Heather S. That means that's my personal sim. So I'm going to use that one, but if you, we're going to go from the top. So if Gia was going to look, so she's going to type in Gia and type that, and that's going to be Gia B Sim. Now, eventually you're going to have a personal account and a sim account. So make sure you're picking the right one. You want to make sure you're writing notes on if you're doing anything on the sim or anything like that, putting your sim in there. If you're with another student, so let's say Gia took an impression on Emily, she needs to write in Emily's chart, not Emily's sim chart, but Emily's actual patient chart. So then she's going to make sure that you're writing in the right ones, because we have to keep track of that. So I'm going to go back and find my own sim. I'm going to hit use. And then you can see that the name is up here. That means Sim Heather S. So that's where you want to put all your information in. So if you're going to take an x-ray, you can do that, and it's going to save that under Sim Heather. You're going to go new exams, click whatever you need for the exams. I'm not taking an x-ray, so that's fine. If you're going to be doing charting, so you can pull up the chart. And this is what we kind of talk about when we're in dental science and things like that. So you guys are going to have to chart all this stuff. And you can be these are all permanent teeth. So 1, 2, 3, 4, 5, all the way down. They're all numbers. You can select all of them, and you can turn them into primary teeth. So if they have that, or select all and go permanent, and maybe they still they don't have these yet. So we're going to click primary. They go away. So it just really depends. But there's lots of different things that you're going to be able to do here. So I'm going to select all and put all my teeth back. We'll go through all these different buttons, so you don't have to worry about that now, but if you have free time in lab, you can click around here and kind of see. So there's different kinds of exams that you can do, but the biggest thing that you guys need to pay attention to is charting. So if I say 1, and there's decay, so you're just going to click decay, and then you're going to click the surfaces, mesial, occlusal, distal, and then it's going to chart that for you on the computer. So we're going to do some charting on paper first, and then you're going to learn how to do it on the computer as well, because next semester we do see live patients, and doctors are going to go through, and you're going to be charting on the computer as we go. So I'm not going to save this because I don't want that on my chart. So no, I don't want to save, and then I'm going to go back out. So that is how you log in using your name, and how do you find your own personal sim. Again, then I'm going to deselect that patient, and maybe I want to write in my own chart. So let's say it was a different assistant, and I'm going to find myself. So I have my own account in here. So that's my personal account. So I need to write in that note if somebody did an x-ray on me or something like that, that would go in the personal one. So make sure you guys are paying attention to which one is which, and you guys are writing the notes in the right area. To write a note, you're going to, let me find my sim first. To write a note, you're going to click right here, note history, and then your notes pop up. Pretty simple. You're going to put in here, patient presents with pain on upper left. Okay, so that's what they're usually going to call and say something like that. And you need to make sure that you put your notes in there. And then I'm going to put my initials, and I'm going to save it. And then now everybody sees that they called on this day, and so they had pain. There should be more detail to that, but every time you talk to a patient or hear about a patient, you write in the notes. You take an impression, you're going to write in the notes. You take an x-ray, you're going to write in the notes. Anytime you left a message for a patient or anything like that, you need to make sure you're writing in the notes. So that's how you're going to do that, and you guys will be practicing, and it'll be nice and fun. I'm going to be done, so I want to log off, and then I'm going to exit here, or I'm going to leave it up, and then the next person can log back in pretty easily.